The first thing is that breast implants aren't life devices. And a lot of people have that perception that this is a one-off thing and it's going to go forever and that's fine. So thought needs to be given to the fact that in due course, implants do need to be replaced.
So a big part of my job is just listening to what the patient is actually wanting to achieve. And so whether it be rejuvenation after having children and breastfeeding, is it to get back where they used to be? Is it something that's going to be smaller, bigger? Are there other new concerns, secondary to gravity, anything, other underlying asymmetries that they want addressed? So listening to what their concerns are is the primary thing with every consultation. Then getting a concept of what their perceptions are from that, really useful. It's 101 plastic surgery, and then trying to examine them and to see how real those concerns are. Are they something that are perceived? Are they something where they're comparing themselves to a previous version of themselves? Are they comparing themselves to images in social media or online elsewhere? Really trying to work out if their concern is something that matches up with surgical techniques, available implants, and then seeing if the outcome is actually achievable for them. So certainly when it comes to the surgery, a lot of the time there's a perception that it's really straightforward, it's a quick, easy, run-of-the-mill thing that people just do day in, day out, and there's minimal downtime. And I need to point out to them that this is pretty involved surgery. There are important things to be aware of when it comes to preparing themselves for surgery, how they prepare their households, their jobs, their time off work, what they do in terms of nutrition, vitamins, all sorts of things like that, and then how they set themselves up. So the big thing with this sort of surgery is that it's very elective, and so they need to think about what has to be considered post-operatively to allow their body to heal really well. So this is a pleasant journey with the outcome achieved that they want. So the big thing is talking to them about recovery and talking them through what sort of supports they might need, how they can set their household up in terms of having it nice and clean, thinking about meal preparation, having as much in place post-operatively so they don't need to get up and do the things that we otherwise have to do every day. If someone has children, I talk to them about that, what they'd normally do with kids. I give them advice about not driving for the first period, so if they need to make alternative arrangements, it's all done in advance, so there's no stress attached to that whole part of their usual routine.
And then collect some information from your local doctor, friends and family about how to pick a surgeon. Do your research by looking at that surgeon's website and their social media to get a feel for their voice and if you think you'll get along with them. When you see your surgeon, articulate clearly what kind of result you're looking for, and then listen to their advice about how you can recover as smoothly as possible. Ultimately, a patient who is happy is one whose expectations are met, and that is a patient who is well researched.